Hello, friends. Hello, Makale. Hi, this is I Want Second Opinion. We have been providing you with health information videos for the consumption of the general public. We have produced so many videos, and thanks for all the appreciation that you have been giving us. Today, we have got a fantastic laparoscopic surgeon with us, Dr. Vedagiri Saravanan. Hi, Vedagiri Saravanan.
Hi.
Dr. Vedagiri Saravanan is a laparoscopic surgeon based in Chennai. He has been practicing and he is the managing director cum owner of Girishwari Hospital in Chennai. His specialty is bariatric surgery. He is a classmate of mine and I have had his acquaintance for many number of years. Hi, Dr. Saravanan. How are you?
Hi, Prakash. It's nice that you are coming out with a second opinion videos on most of the health problems. That's really helpful intention towards the general public. So that's a great thing to do. And see, I've been practicing in Chennai for the past almost 20 years, surgical practice purely. I'm interested in laparoscopic surgery, especially bariatric surgery. We've been doing a lot of procedures in bariatric surgery like sleeve resection, bypasses. The latest was balloon replacement, which is a non-surgical procedures like a simple endoscopic procedure where the patient lose their weight, 60 to 80% of overweight in a year's time.
So that's amazing.
It's a real good thing because instead of going for a surgery and its complications like leakage and other malnourishment, so this is the best way to reduce the weight. So it's really medically recommended and practiced all over the world. So I'm doing
it is a non-surgical balloon introduction procedure for obese patients on weight reduction. Yeah.
Yes.
All right. Okay. Now, we will certainly look into that particular topic of interest in the near coming videos. Today, we will concentrate on the point which we discussed, which is the gallbladder infection. Right. Exactly. Let's jump into the topic. Saravanan, could you please tell us in layman's terminology, what is gallbladder infection and what symptoms they will be having?
Yeah, basically gallbladder is a storage organ. It's a tank. So liver works 24/7, but the bile which is used for digestion is minimally used, like 3 times a day or plus, because we are eating only three times a day. So rest of the bile is stored in gallbladder. Gallbladder is a small pouch kept underneath the liver, which is connected to the biliary tree. The biliary tree in turn joins the small intestine duodenum along with the pancreatic duct to cause digestion. So this sac always have some amount of bile. If there is something goes wrong, because bile has got a lot of crystals, all small crystals. If something goes wrong or some infection or a stasis of gallbladder juice for some time, it causes precipitation of the small crystals. The precipitants in turn become bigger and bigger, forms a stone. That's called gallstones. It's because of various reasons, this static gallbladder juice can be infected by bowel organisms. So that is called cholecystitis, gallbladder infection. That causes pain and vomiting and fever, a lot of variations like any other systemic infection. That is the reason for this cholecystitis.
All right. Now, which group of people are at the risk of developing this gallbladder infection? Like, is anyone going to develop this infection at all, or are there any specific risk factors are there?
No, there are various reasons for infection. Patient, there's no group like that. Those who don't eat on time, those who
Okay.
don't eat properly, they will have stasis of bile in the gallbladder.
Okay.
So those kind of patients will go in for infection.
Right. Okay.
So it's not group specific or patient specific, person specific. Anybody
It's
can
not.
go in for infection. And
Alright.
if the bile is clear, there is
Mm.
no chances of infection. No, if
Right.
any stasis, long-term non-moving of gallbladder, dyskinesia, and all that can cause infection, and that causes precipitation of small crystals forming a big stone. Stone becomes another major problem for
Okay.
gallbladder infections.
Okay. Does high BMI individuals or patients who have got high cholesterol, are they at the risk of developing this gallstone, and as a result of which infection can happen?
Absolutely, absolutely. Because see, this is a saying in medicine called fatty 40 female. Those, no, it's a mnemonic.
Yeah,
So
yeah, yeah. I remember those
fatty
words.
ladies will, yeah, fatty ladies will have
Mm,
gallbladder because they eat more, and
mm,
automatically the secretion from the liver will be more, and the
mm.
storage also will become more. So when the
All right.
storage is more, the
Mm,
stagnation of the bile will be
mm,
longer time,
mm.
and it causes precipitation, forms stone.
All right.
So
Okay.
those who have high cholesterol and this BMI is more, then they'll form stone.
All right. They form system. Okay. Right. Now, if anybody develops an infection of the gallbladder, what are the symptoms do they present to you with?
Okay. Usually, those patients who are having gallbladder stones, or even there is a condition called Acalculous cholecystitis, where there need
Okay.
not be any stone in the gallbladder, but they'll develop
Okay.
gallbladder infection. So the patient will have pain in the right upper abdomen,
Okay.
sometimes which may radiate to the back at the same level. No?
Right. Okay.
Right? And patient may develop fever, vomiting.
Yeah.
These are all the symptoms.
All right. Okay. Now, without infection, if there is purely stones in the gallbladder, will it produce symptoms at all?
Actually, there is a condition called gallbladder dyspepsia. Gallbladder dyspepsia means it can cause various symptoms, GI symptoms, like loss of appetite, bloating of abdomen, bloating of upper abdomen alone, indigestion, and a patient may complaining of nausea. Generally, even after eating, there will be nausea. So many conditions. There are almost 24 symptoms which all called as dyspeptic symptoms of.
Right. Okay. Right. Then these symptoms almost
GI.
mimic. Right. Okay.
Or gastritis. Mimic gastritis. Patient will be kind of misled, taking all this pantoprazole, omeprazole, and all, but the symptoms will go temporarily and come back again. So those kind of symptoms can be due to gallbladder stone and its infection.
Right. Okay. Now, how prevalent or how common are these gallstones, and how common are the complications that are associated with the gallstone, like infection and stuff?
In my practice, for the past almost 20 years of surgical practice, I can say around 30% of the patients are having symptomatic or asymptomatic gallstones.
Okay.
Out of that, almost 5 to 7% of patients develop complications because of gallbladder stones.
All right. Okay. Right. Now, if they sustain an infection, how quick does a patient needs to come and see you?
They should come immediately. No, there should not be any delay, because people will be developing other complications because of the gallstones. So they should not think, if the symptom doesn't go away with the pantoprazole or omeprazole in a day or two, immediately they should consult a doctor, surgeon, or a gastroenterologist. They will do all this investigations like blood test and ultrasound abdomen scan to rule out gallbladder stone. So they should go, because you should not wait for complications. And treating the complications is another real problem for the doctor.
All right. Okay. All right. Okay. Now, you told that
better
when
to
a
go
patient,
to the doctor early.
as early as possible. You mentioned that when they come to you, you investigate them with the help of some blood tests and some scan of the abdomen. What are the blood tests and what are the scans that needs to be done for the patient?
See, for the blood test, we ask for complete blood count, wherein this total count will be elevated in case of any infection. Any infection, the total count will be increased, and C-reactive protein also will be increased. We specifically ask for liver function test. So the liver function test will tell you if the gallbladder is just has got stone, or it has caused complications like slipped stone inside the biliary tree. If there is any just simple hepatobiliary jaundice, I mean, like it'll have only elevated enzymes. SGOT, SGPT will be more, and bilirubin will be more. Mainly it is indirect bilirubin. In case of obstructive jaundice, suppose it's caused by gallstones, the direct bilirubin will be more, alkaline phosphatase will be more, and GGT also will be elevated.
Okay. All right.
So this, on this basis, we can come to a conclusion slightly whether it's obstructive jaundice or hepatocellular jaundice, or whether the obstruction is at the level of gallbladder or at the level of biliary tree down. So we have to calculate all that and treat the patient accordingly.
Right. For a layman, these investigation findings, how does it affect in terms of treatment for them, for a layperson who comes?
Yeah, see, definitely it gives a clue to the doctor where to intervene, when to intervene the patient. We can treat them medically if the counts are not high, and we can, if the other like investigation in investigation, I said ultrasound of the abdomen. If the ultrasound says just sludge in the gallbladder or small stones less than 4 millimeter, we can treat them conservatively if there's no much of symptoms.
Right.
So initially, if the stones are more than 4 millimeter, less than 8 millimeter, better to remove it, because the slipped stone can go and obstruct in the biliary tree, causes jaundice. The biliary tree, the lower end of biliary tree, which is opening in the duodenum, that small intestine, is only 2 millimeter.
Right.
That opening. That opening.
So biliary tree, for the information of the general public, what exactly is this biliary tree?
The biliary tree is a set of tube coming from the gallbladder. Coming from the liver. Which for both left and right lobe, and which joins together. Below that, the gallbladder duct, cystic duct. We call it a cystic duct. That also a tube. The system of tube. That's all. And the same tube is extending along with the pancreatic duct. That's a tube. Both together joins the second part of duodenum. That is the beginning of small intestine, where it helps the chyme, which is coming from the stomach, the grinded food that comes from the stomach, and these juices will help in digestion in all along the 6 meter. 6 meter tubal system, which is connecting the liver and the duodenum. That's called biliary tree.
All right. Okay. So even if it is asymptomatic, which means there is no symptoms because of a gallstone, depending upon the size of the gallstone, you will advise the patient, even if there is no infection, you will advise the patient whether the patient might need a surgery or might not need a surgery. Yeah.
Yeah, actually, there are few conditions where even asymptomatic gallbladder also needs to be removed.
Okay.
Like patients with stones, asymptomatic, but they are diabetic. So there is chance of infection in the future anytime, any moment. So getting into complications, better to remove them prophylactically, preventively, so that they'll be off the complications. Or when we do other surgeries, other simple surgeries, simple laparoscopic procedures, when you have stone in the gallbladder, at the same time, for example, if the patient is going for laparoscopic removal of the uterus, and when she's got a stone in the gallbladder, better to remove the gallbladder and as well as the uterus. Combine these procedures. Most of the surgeons, they don't, but I do combine these kind of procedures. Like patient has got appendicitis or mild without major infection, major contamination, I remove the appendix as well as I remove the gallbladder. But first preference is given to gallbladder, remove the gallbladder, which is non-infectious or clear gallbladder, finish that work, then come to the mild infection area like appendix and remove them. That's it.
All right.
So those are all the conditions we remove gallbladder, even if they are not symptomatic also.
Right. Okay. That's very nice to hear. Dr. Saravanan, thanks a lot for the wonderful insights that you gave regarding this gallstones, gallbladder, and the infection in the gallbladder. In the next series, next part, what we will do is we will discuss about the treatments, the complications and everything, and how long the patient needs to stay in the hospital, all those kind of stuff. Thanks for participating in this wonderful this program. Much appreciated, Dr. Saravanan.
Thank you. Thank you, Prakash. Bye.
Bye-bye.